Thank you for joining us for today's ASPPH Presents Webinar, Where Do Public Health Graduates Go? Results from the ASPPH Graduate Employment Pilot Survey and Plans for the Future. This webinar is part of the 2015 ASPPH Presents Monthly Series, which has been designed as a service to CEPH-accredited ASPPH member schools and programs of public health. A few housekeeping items of note. While you are in listen-only mode and your lines have been muted, we encourage you to ask questions throughout the presentation by using the question box. This webinar is being recorded and it will be available on the ASPPH website soon. Additionally, this webinar has been approved for 1 hour of CPH continuing education credit. Our speaker today, Christine Plebis, is the Director of Data Analytics of the Association of Schools and Programs of Public Health. Thank you, Christine.
Thank you, Sarah, and thank you to all our viewers out there joining us today. I'd also like to acknowledge my colleague, Emily Burke, who assisted me with this project, and also acknowledge the support of CDC. I'm going to go over a few things today, give you a little bit of background on the history of graduate employment at ASPPH, talk about our pilot project that we did in 2014, and a number of the objectives, challenges, the development and design and results of that project. I'll then talk about lessons learned and plans for the future. ASPPH has had previous projects that collect graduate employment data. Some of these go back to the last century, 1970s, 1980s, when we conducted a longitudinal study of graduates of schools of public health. This is some great historical data for us to reference as we continue on with our project into the future. ASPPH also did an exit survey process in 2004 to 2006. This was just an exit survey of our members at that time, which was at that time just schools of public health. This process and this development of this exit survey was then taken over by the Council on Education for Public Health from 2007 to 2010. They used the same type of questions. At that point then, the CEPH had to simplify the process for graduate employment, and these questions were no longer used. So many of us out there want this data. We really want to know where our graduates are going. And when I thought about it some more, I had a realization. I wasn't walking the talk. When I give this presentation in person, I ask the audience out there, I say, who out there has told their university where they are employed? So you all can do that in your rooms if you have multiple people out there today. When I've done that in the past, I've noticed not a lot of hands are raised. So this is my confession right here, that I only recently, because of this project, have now let Texas A&M University know where I work. So I encourage you all to do that as well if you have not. So our objectives today. Well, first off, I want to talk about a previous project that we worked on with CDC, and that was looking at the National Center for Education Statistics data. And we were looking at conferrals at both the graduate and the undergraduate level for public health. And we saw that there were increases in both of those categories. This graph here shows data from ASPPH members, which is also showing an increase in graduates. It's a little bit skewed because our membership has also increased, but nonetheless, the growth is there for the number of graduates in public health. So we noticed by looking at this public health workforce through the lens of the graduating students, it brought to the forefront the question of where do these graduates find employment? So that is our objective of our pilot project, to answer the question, where do these graduates of schools and programs of public health find employment? So we want to answer this question by building a cohesive data collection methodology with our member institutions in order to provide a reliable aggregate answer to this question. We also want to gain an understanding of the pipeline into the public health workforce by looking at these graduates. So our first step was to conduct a pilot study to see what might work. There are a number of challenges, though, of course, with this data, as I'm sure a number of you out there are aware. Aside from governmental public health, there is very little data available on the entire public health workforce. The Bureau of Labor Statistics has limited data with a large number of challenges, with a definition of what constitutes a public health job. So ASPPH is uniquely situated to reach out to our graduates of our member institutions. Our challenge, though, is how to get all our members to fly in the same direction. A saying I like to say is that we have about 100 members and we have about 100 different ways of doing things sometimes, or at least it feels like it. And for our graduate employment, there are definitely a lot of differences. There are different data collection methods. Some use surveys, some use internet and social media, others use faculty, or some use a combined approach for collecting the data. There are definitely different survey questions and response options across the board. And there are different time frames. Some of our members have annual surveys, some do exit surveys, some do a combined approach, asking graduates 0, 3, 6, 9 months after they've graduated where they have found employment. And there are very different response or knowledge rates, as they're called, in graduate employment. And they can be low sometimes due to the difficulties in tracking graduates and the survey fatigue that the graduates feel. So we have taken on these challenges. And by we, I mean us and our ASPPH and a number of our partners. The ASPPH Data Advisory Committee is the lead on this project. We also work with a number of our member forums, our career services and student services. And of course, we've had our partners, CDC, specifically the Centers for Surveillance, Epidemiology, and Laboratory Services. And of course, our partners are participating member institutions. Our time frame in our development and design was that the data collection was done in March to June of 2014. And our survey population was only graduate level alumni from spring 2013, summer 2013, and winter 2013-2014. In developing the pilot and in developing this project into the future, we had a number of assertions going forward. We definitely knew we needed to do a pilot year in order to learn how this process would work with our membership. We also recognize that our members have to recognize the benefit to their own institution in order to encourage participation and in order to give us their data. And we know this project is and will take time to implement across all of our member institutions. We know that a number of our members have previously collected graduate employment data and they have their own trend data going for many, many years. And so we don't want to just replace that data, we want to work with that data as best possible. And we know that we wanted to give our members data that they could use for benchmarking and looking at their peer groups. And so that was another part of the kind of the carrot to get people to participate. So how do we design this pilot? We had two options for participation. The first option, option 1, was to use our ASPPH Common Question Survey. This was a survey that was developed by the ASPPH Data Advisory Committee with input from our CDC partners and others. The intention of this survey was that members could use it as a standalone survey on graduate employment, or if they had other surveys that they did after of their alumni that might ask about how they liked their program, and in that case, these surveys could be inserted into that to their alumni survey in order to grab their graduate employment data. We also noticed, I just want a little side note, that we did notice when we were doing research on our member surveys that a lot of them had still used the exit survey from 2005 to 2006. And so we were encouraged that those questions are still being used for our future process here. The option 2 was the institution design survey. And once again, these are those members that have been collecting graduate employment data and have a lot of trend data, and they have a process that they're set with. But we wanted to make sure we incorporated that data as much as possible in our pilot program. So this project was supported centrally by ASPPH and conducted locally at the institution. So as ASPPH provided to our members the project plan and guidelines, an online data collection via SurveyMonkey. We could transfer the survey immediately if someone else had a SurveyMonkey account. And we also provided a number of alumni tracking ideas. The members, in return, after conducting the survey locally, would provide us a raw data Excel sheet a copy of whatever survey they used, their response rate, and just information on what kind of methodology they used. I want to do another side note here and just talk about who was our contact at our member institutions. And this is, I think, a little bit interesting because in public health, at schools and programs of public health, the person collecting the data on graduate employment can vary. Sometimes it's the career services director or staff, if there is one. Sometimes it falls under an associate dean type position, and other times it's in the institutional research or data office. So it's a combined approach of all the different avenues and different people that we connected with about this survey. So for part of the project plans and guidelines, we provided some alumni tracking ideas. So I just wanted to present a few of these to you all today. And these, everything I'm talking about today and more is available in our report online. So these are some alumni tracking ideas that our career services and student services forums came up with the help of our data advisory committee. So their suggestions were that before the student graduates, so you want to remind them of the important connection between them, the school or program, the faculty, and their fellow students. You want to encourage them that the education is lifelong and that they should use the school or program of public health as a resource. Once they've graduated, you want to keep your alumni engaged. You could hold a social event, hold continuing education events. You might want to provide opportunities such as connecting alumni with applicants or a mentoring program. You might want to follow up periodically with the alumni, whether that's through social media, newsletters, more surveys. And you want to make sure that there's possibilities for them to engage and for the future, for the students that come after them. And one creative idea was to have an alumni raising money for students. And you want to also communicate with employers of alumni, just another way to get around to those alumni. So finding the alumni, where did they go? Well, in this day and age, social media is a very popular way of finding graduates, whether it's through Google, LinkedIn, Twitter, Facebook. Contacting any alumni associations or departments, and one that we heard often was contacting faculty of alumni. Sometimes they're in better touch with the alumni to know where they're working. And of course, you want to develop a tracking system, however you want to do that, to keep tabs on your alumni. So there were a couple of different data collection methods that our participating members did use, and some of them I just mentioned. And these were all, we heard from the participating members that they did use all of these mechanisms here, whether it's online surveys, whether it's an internet search, faculty, and some even used phone and good old-fashioned snail mail. For the timing of the surveys that were given to us, we had 3 members who used an exit survey only, and that was accounted for about 5% of our respondents. And you can imagine that there are some issues there because that is information that's gathered only at the time of that the student graduates and nothing further. So you probably have a smaller group that have actually found jobs. 49 members did true alumni surveys, and that accounted for most of our respondents. And probably the ones with the highest response or knowledge rates were those that did the exit and alumni surveys. There were only 5 of these members, and they were accounted for 30% of respondents. So these are some of our bigger programs who have probably been doing this a little bit longer. So what did our common questions survey include? We asked all the standard demographic questions. We asked about education. We were particularly focused on their recent public health degree, but we also asked about what other types of degrees they had. We wanted to know if they were thinking about continuing their education, and of course the important one, the employment status and their employment information. Were they employed and where were they going to work? We also did ask job title and the name of their employer. We then went on and asked a few questions about salary and debt. So these were all the areas for our common questions survey, and the institutions who chose our option 2 to include their institution design survey sometimes included all of these categories. Most often they just included part of them. So that was our job, to do sort of a meta-analysis of all the data to bring it together into one database to figure out what kind of aggregate data and aggregate answer we can get to the question on where these students go. So now we'll move on to the more interesting part of the presentation, the results of what we've done. We had 57 of the, at that time, 93 ASPPH members participate. And that gave us a survey population of 4,867 graduates. Overall, we estimate that there's probably about a 54% response rate, and I can tell you those varied quite significantly from 6 to 100%. So, but what we did have everybody send us was their number of respondents in their survey population. So that number is pretty accurate. And as you can see from the slide here, the majority of respondents were from option 2, which is the institution design survey. And if you look a little bit more closely, you can see that our they were mostly from institution design survey. Most of the responses were from our schools of public health members. So we asked what their most recent public health degree, and as you can see, MPH, the Master of Public Health, was the most popular at 66%. The top 5 listed here, MPH, MS, PhD, MHA, and MSPH, pretty much mirror our annual graduate data that we collect every year. We also asked what was their area of study. And these areas of study are from the ASPPH annual data collection. So we had to do some recoding sometimes of some of the areas. So this is what we used in the common question survey. So as you can see, there's throughout the presentation you'll see that master's degree is in the green and doctoral is in the blue color. For master's degree, the Health Service Administration was the top area of study at 20%. Followed by epidemiology, and then health education, behavioral science. For the doctoral, the epidemiology was the highest at 27%, health education, behavioral science at 13%, and environmental science at 11%. Just to give you an idea, because since we are splitting these up, we had overall approximately about 4,000 maybe 4,200 master's degrees and about 500 doctoral degrees, just to give you an idea of the ends on those. So now you know what the survey respondents look like. Let's get to the answering of the question about where these graduates go. So this slide shows the employment status by degree level. Once again, the master's degrees are in green and the doctoral degrees are in blue. And once again, just a reminder that these are recent graduates. They're supposed to be within 1 year of graduation. Some, of course, are at their exit survey. Some are further out. So overall, from the pilot program, we noticed that 72% of the master's degrees graduates have found employment, were employed, and 75% of the doctoral. For the fellowship, internship, and residency categories, there were more doctoral students, 15%, who were going to this type of situation after graduation, versus a little less than 5% for the master's degrees. So the not-employed, this is where the complications come with our pilot study and in trying to incorporate all the different data and all the different questions. So there were a number of surveys that just said not employed, a smaller number that said not employed, not seeking. So, and then we have a small category of unknown. So the not employed status includes survey respondents for not employed and not employed seeking employment. The results here should be viewed with caution, however, since not all respondents were given an option to select not employed and not seeking. So as such, the not employed status could be inflated. The majority of respondents who were reported not employed, not seeking, or whose employment status is unknown, the last two categories on the right, are continuing their education. We did look into that. And speaking of those folks who are continuing their education, we asked what they were going to continue to learn about. And here you can see the top choices, with epidemiology at the top at 24%, followed by health education, behavioral sciences, health services administration, and biostatistics. So where do those employed graduates go to work? Well, because of all the different response options, again, we kind of clumped them into different employment sectors, kind of a bigger bucket, you can say. So you can see these recent, or once again for the recent graduates by the degree level. And not surprising, the doctoral graduates are employed by university or colleges at 52%. Following that for doctoral is 13% for government and 13% for profits. The master's students, graduates, are more evenly distributed. University or college and healthcare are fairly even at around 20%, followed by government, or 22%, followed by government at 20%. I will note that the healthcare sector for 87% of respondents who work in a hospital, of these who said healthcare sector, 87% work in a hospital or other healthcare provider setting. And after that, 13% work at a pharmaceutical, biotech, or medical firm. Overall, less than 1% of respondents said they are employed at a health insurance company, which was included under the for-profit sector. Let's look a little bit more closely, though, at the breakdown of the government. And this will give you more of a sense of some of the complications with doing the meta-analysis on many different types of surveys. So here we had 578 master's and 48 doctoral graduates. And at the federal level here, you can see for the master's degrees, 33% went to work at the federal level. Combining the state government not health department, and state health department, that comes up to 27% of these master's degree graduates going to work in the state health department or state setting. And beyond that, it's 16% at the local government level. For the doctoral, you see 65% went to work at the federal level, followed by 17% at the state and 2% at the local government level. So one thing of interest with some of our member schools and programs is that a number of programs might be a part-time program, and the students might continue working while getting their degrees. So we tried to assess this and suss this out a little bit by asking whether they were employed, if they said they were employed, if they were employed in the same position prior to or concurrent to earning their recent public health degree. And you can see here that most of the graduates went to a new employer. A lot of complications with this data, and we definitely need to work on this question a little bit more, since some of these could have been employed, as a graduate assistant, and then found a so-called real job afterwards, right? And so they found a new employer. So this data is a little, not the cleanest section, but from just an overview point, it looks like most people went and found a new employer. So we also asked whether the respondents who were employed, whether they consider their work health-related and whether they consider their work public health-related. And you can see here that in both of these categories that most of them do consider their work health and public health-related. So I know this slide is a little bit daunting, so I'm including it because I think it's a little bit interesting of what we did here. So in our analysis, we had a ton of job titles and a total mess on our hands. So we used the public health taxonomy that was developed by Dr. Bolton and others to code this data into what they call a job classification. So that was a big project for one of our staff members to do, but I think it's been very interesting to look at it, and it helps kind of assess the data a little bit more. So what you're seeing here in the middle column is the job classification. These are the top 25 job classifications by employment sector, and that is across the top. So the whole table adds up to 100%. So the darker areas are the ones that you see the higher percentages. So it kind of shows you where the top job classifications are. And some of these are job classifications are analyst or coordinator. Some of them are public health or program project manager, and research assistant is one of the top ones. So this table and another table similar to it are in the report available on our website if you want to look into it a little more deeply. So we ended up using wider salary ranges for our data analysis, just because, once again, there were a lot of complications with the data just when people are using different salary ranges, or most people did use salary ranges. I think a few might have actually asked what the actual salary was, but not everyone asked this question. I am happy to report, though, of those that did, we got about a 70% response rate to the salary question, which I think a number of people were surprised about. So you can see here the highest salary range was for both master's and doctoral recent grads was in the $50,000 to $75,000 range. Now, a few caveats with this data is that this could be their first job, or this could be a continuation of a job that they already had. And this data does also include part-time and full-time employment. We asked about debt as well, and the return on investment for degrees is becoming a hotter and hotter topic these days. So as you can see, doctoral students have a higher no debt category than master's degrees. And for master's degrees, the $25,000 to $50,000 and $50,000 to $75,000 were the top categories. And we asked this data here is showing for their most recent public health degree. We also asked about total degree debt, and that's in our report as well. So we did a couple of reports. The aggregate report, which is available to our to you all on the phone and to our members, and it's available on our website. You can find that there. We also did a benchmarking report, since we promised our members to do that, but we learned a lesson there, because it was kind of troubling due to the different response rates and also different graduating class sizes. We have some members that have 15 graduates. We have some that have upwards of 300. So we have to rethink that in the future, what we want to do. And we do have plans, hopefully in the future, probably further into the future, to eventually have a dashboard for clicking through and slicing and dicing this data by our members. So we learned a lot from this pilot. We learned that our members want this project to go forward, which was very encouraging. We learned that they want to share best practices for collecting this data, and they want to be part of an organized effort to provide better aggregate information. I think we all recognize the benefits that this data could be used for student recruitment, for advocacy, for funders, and more. So we plan to move forward with this project for our 2016 data collection. It will still take a while to implement across the board, as one of our assertion states. So we are working with our internal partners, our Data Advisory Committee, our Career Services Forum, and other members to develop the work going forward. But I do want to talk about some of the lessons learned that we have come across. First, we need to define our data elements better. We need to know, what does it mean by employed? Is that 30 hours a week? Is that 35 hours a week? We need to know, what does not employed mean? Is it not employed not seeking, not employed seeking? There are a lot of different ways to clean up this, how we ask the question, so that the data is cleaner. And we want to align with our timeline with the CPH timeline. With the current criteria that's out there, the December 2016 data would be submitted for academic year 2014-2015 graduates. So we don't want to do this springtime data collection. We want to move toward our reporting to the December timeframe to match them, and also match our annual data collection. There is potential. I'm not sure what is coming out with the CEPH criteria in the next couple of weeks. It'll be interesting to see if there are any changes to the data that they require as far as graduate employment. We want to allow for flexibility in data collection. This is coming from the fact that our members, we have to be flexible. We can't force everybody into the same bucket, and that our members have different staffing as far as career services, as far as collecting this data. So there's just whether they want to do it at a single point in time, to collect this data once a year, whether they want to collect it for each graduating cohort over the course of an academic year, or if they want to do the method that seems to get the highest response rate and also is more labor intensive, if they want to follow the graduating cohort, ask them at the exit survey, followed by 3, 6, 9, and 12-month intervals. That one does seem to get the highest response rate, but it does take more time. But we just want to make sure we're flexible in how the members, the timing of their data collections. We also want to align with national efforts on graduate employment, such as the National Association of Colleges and Employers. They have I think new this year, a strategy for collecting data at the graduate level. They started last year doing one at the undergraduate level. And we want to define what are mission-critical data elements. These surveys can explode easily because you want more and more data, but you have to keep in mind what can you collect, what is somebody willing to take a survey on, what can you find online, what can you not find online. And speaking of online, we have to move to online data reporting for this data. It was quite labor-intensive on our end to get all those Excel sheets and do the meta-analysis with them. And we want to develop a better benchmarking tool for the future. So that ends my presentation here today. I will encourage you to check out our website, where you can go under resources to find more information on the Graduate Employment Project. And I'll turn it back to Sarah.
Great. Thank you, Christine. We will now take the time to address questions. Please submit your questions by typing them in the question box. So we have a few. Let's see here. Can you break down the salary data for the different areas of study? It'd be helpful to us as we recruit students for different programs.
That is a popular question, and I think that is something we can get to in the future. Right now, the numbers are too small to break it down by all the different areas of study, or even by beyond degrees. We could probably do it for MPH, but everything else is just a little bit too, the numbers are too small. But I imagine as we move forward, we'll be able to get that data.
And then a follow-up, and possibly the same answer. Did employment outcomes vary by area of study?
And it is, you're correct, Sarah. That is. So I actually don't remember, but I do know some of the areas of study were so small that it was just very hard to tell. Once again, I think we need more data in order to really provide that information, because I know a lot of our members want that for their specific programs.
Great. Did the response rates and employment, did the response rates differ between the 3 survey timings?
Yes, definitely. And it does seem like the timings, the more labor-intensive one, where you follow up at exit survey and then follow up at different time intervals afterwards throughout the year. The one slide I think did say 3, 6, 9, 12 months. And some of our members did at exit 6 months later, 12 months later. So it does seem like that methodology provides a higher response rate.
And then following up, when schools use the different methods of tracking down alumni, how do they know that the information they find on the social media is accurate?
Yeah, that is a really good question. They don't know, but technically I think everybody should be confirming that as best possible. You never know what somebody's out there, and you don't know if it's accurate, if they changed since then. So as much as possible, we want to check those resources out for accuracy.
Great. Did you collect data on the type of government agencies respondents were employed at outside of health departments?
We do have a list of the places of employment. We haven't gone through that one. That one is just a long listing. Everybody uses different ways of writing it out, so we haven't dove deep into that one yet. We just did right now into the job titles, and that was a little bit more manageable. But we do have that if there's something you're specifically interested in. we can, sorry, we're having a little technical glitch there if you saw the screen go black. But if you're interested in something specific, definitely contact me. I can look into the data for you.
What method of collecting data did those schools with the highest response rates use to collect that data?
Yeah, that goes to that multi-pronged approach of using the exit survey and then following up at different time intervals up until we are aligning with the Council on Education for Public Health as much as possible as far as graduate employment, and their criteria currently say it has to be within 12 months. So they want to make sure that somebody has found a job within those 12 months. So you want to do it from exit to 12 months out.
Great. And then are there plans to align the timing of the data collection with NACE 6 months out versus CEPH 12 months out?
Well, that's a good question. One we have to figure out. If you do follow NACE, then you are within the 12 months for CEPH as well. However, they are currently I say, they do have that 12-month requirement in their criteria. But once again, they are coming out with new proposed criteria, I think in a couple of weeks. So I encourage you to review that and respond as you would like to see it changed if it's still included that way.
Given the interest on return on investment for graduate degrees, does ASPPH have any data or plan to collect data on career paths, particularly to focus on salaries after a person has been working in public health for a few years?
Yes, that's a really good question, especially because what we're developing here right now and into the future, and hopefully will continue for a long time, is from our recent graduates. So that data is just right out of the chute, but some of those students have been working for a while. Some of them might have other degrees. It might be an MD who just went back to get an MPH, or it might be somebody who went up through the ranks and got an undergraduate public health degree and then a master's, and what are they doing? So those are very different ends of the spectrum. I do think it's more interesting, and like what we did in the ASPPH at that time did last century in the 80s, 70s, 80s, looking at a longitudinal section, cross-section, to see where to follow those career paths, and that is something we are looking into doing right now. It's fascinating to look at that study because back then they actually sent out paper, and they got some paper surveys and got them back, and they had some really high response rates. So it's interesting now with survey fatigue and online surveys, and I don't know, tracking people, and you think it's in some ways easier now than then, but we are looking into doing that now because I think that would be a fascinating study to compare with the data from 40, 50 years ago.
So what is the anticipated timeline for the next survey?
Yeah, so exactly, that's a good question. We are working closely with our information technology staff here to make sure that we can do the online data reporting with our annual data collection. We have a system set up for our regular annual data, which includes students, numbers of students, graduates, faculty, and a couple of other areas. So what we need to do is add this into that data collection. Of course, the big question is, what exactly do we add? We have a small working group right now working on this, and we are a little bit waiting right now to see what that CEPH criteria might look like, just to get I know it won't be confirmed at that time, but just to get a little heads up into any changes we want to make. Maybe there's ways we can align with efforts into the future too as CEPH changes. So we'll see how that all goes, but we do plan to collect this next year.
Great.
To start collecting. It will take time. I'm not sure. I don't think all our members will participate initially. It's going to be a little bit more challenging than our other data collection because if you do use your own institution design survey, you will have to recode all that data to what data we will be asking for. But I have hope.
Is there any breakdown on geographic regions?
That is something we could do. We don't know, we only know by where the university is located. We don't know where they found necessarily where the graduates went to work, though.
And then this question, I have a concern regarding sharing benchmarking or comparison data publicly so that employment outcomes and salaries listed by specific schools are visible to the public. This is because different geographic regions have different salaries, different enrollments by degree type, and area of study have different employment outcomes.
Definitely. That is, we right now only and always will probably put out publicly just the aggregate data and keep it for our members only, any type of benchmarking type data. And it's a matter of training our users that this data, the way you look at it is depends how, where you are. Are you from New York? Are you from Texas? Are you from Kentucky? I'm from Kentucky, so I'll use Kentucky. and so there's interpretations with the data that must be taken into account when looking at those types of things. So that's why the first report didn't work out very well at all. And if we do look at doing a benchmarking report into the future, it will be by different categories. Could be by size of institution, could be by geographic area. And so I think there are ways we can report the data out that will be more effective for the user, easier to assess, and hopefully helpful in the end.
Great. And then somebody else asked, have you looked at any other national associations and their methods of collecting data?
Yes, we have. I've talked to a number of other the lawyers group, and we've looked at the business folks and medical colleges, of course, and so we've spoken with a number of these people, and it was interesting to learn their processes and how long it takes to get it going, get this process up and running. And there is, I know, a desire out there to make sure all the accrediting bodies, all the government reporting, all the association reporting all aligns, and we're very cognizant of that and have starting not only in graduate employment but a number of other efforts with our data to try to make that happen as much as possible, to start making those cross connections with stronger with CEPH, with from the other health accrediting bodies as well.
That's great. And then this person asked, what does next year mean? When would you want us to start collecting data?
Gotcha. So I'm saying reporting in 2016. So that, if we align with CEPH, that would be reporting by December of 2016, and that would be reporting on academic year graduates or graduates from academic year 2013-14.
Great. Well, thank you very much, Christine. Very informative. And thank you all for joining us. Please be sure to contact us with any additional questions, and I'll put Christine's direct email up there for the moment. As a reminder, the recording of this webinar will be available on the ASPPH website soon at the address on your screen. We will also follow up with an email with this link when the webinar and the slides are posted. So be on the lookout for that. And please register for the next webinar in the ASPPH Presents series, ASPPH and the Community Guide Partners in Public Health, which will take place at 1 p.m. Eastern on Tuesday, November 10th. Thank you.